Kardos. I'm the Director of Patient Services for New York State, New Jersey, and the state of Florida. I've been with White Glove for approximately 10 years, and I find it very rewarding to assist both pediatric and adult and geriatric patients with excellence in home care. The vision behind the expansion into White Glove in Florida came very organically. I had an opportunity. I was the director of New York and New Jersey and had the opportunity to move to Florida, where I jokingly suggested, hey, let's start up in Florida. And we did. So it came about through strategizing with two women and the CEO, and a vision for assisting in a very needed market in South Florida. White Glove is known for two distinct markets. One of them is our geriatric population. We do provide excellent service. We train our home health aides and our nurses in our offices. We expanded both the orientation and the in-service programs to better educate our caregivers. And that gives us a better ability to deliver care at the patient's home as they require it. We do two things very well. One is the geriatric population. The second is a pediatric population, where we can add home health aides to a pediatric case, as well as nurses, long-hour shift nursing with RNs and LPNs. For acute care with ventilators, tracheostomies, oxygen at home. So we have the ability and the skills lab to train our caregivers in this specialty. White Glove Community Care's vision, and the vision by our owner, is to serve the communities. And that is why she made sure to add community care in her name. She's very clear in her mission, and we all understand it very, very well and agree with it. And that is to serve communities, to help make the lives of all the people around us a little better. Geriatric care can be very tricky. Most people, well, I'm going to hazard to say all people, do not like to lose their independence. So it is a process to have the elderly accept care when they need it. We see the adult children see, the outside nurses, doctors, and caregivers see when a person has reached the point where they require, for safety needs, some assistance in the home. What we do at White Glove is we work through that with the client to make sure that they are very comfortable with what we do. A registered nurse first helps with the start of care assessment to ensure that they sit with the patient, the client, the family, and anyone else that they would like to have involved in this, so that we may understand what they would like to have. Then we tailor our plan of care per regulations in the state of Florida. We tailor our plan of care to meet the needs both perceived by the patient and observed by the RN, so that we can continue to keep that patient as safe as possible, as long as possible in their desired environment. And that could be in an assisted living, or in a home, or in some other group area where a home health aide could assist, or a nurse, to keep that patient safe where they desire to be. Aging in place is a goal that we pursue. We want people to remain in the environment they choose. And if that's at home or in an assisted living, that is their choice. And that is what we will work very, very diligently to ensure that they maintain for as long as possible. Um, so when we do this, we reassess our patients every 60 days with an RN visit. We ensure that our caregivers are supervised as they need to be, or when there is a change in condition or a change in medications, we have an RN review this with the family and with the patient to ensure that that they have the needs surrounding that change. I will give you an example. If a patient were to start on a blood thinner, we would then put bleeding precautions in place to ensure that our home health aide or our nurses are observing for any signs, symptoms of bleeding in that patient. We educate the family, we educate the patient as needed, and that way we keep them in the home longer. We are also dementia experts. We help take care of a patient where they are. We don't try to bring them to a place that they either don't understand emotionally or physically, and we deal with their behaviors and their needs in that moment. Yeah, so we have a couple of tricks for that. The first one is we recognize that that is very important. I recently had to have a little home care myself after a pretty bad accident, and I did not like having a stranger in my house. So I did just recently get to experience that firsthand. Um, and I wanted my independence. Of course, I couldn't. And until I could, I had to accept it. And what we do is I already explained that we have an extended orientation and in-service program, and in that we teach our home health aides and our nurses to have a very small carbon footprint. We explain to them that people don't really would like to have strangers in their homes. Now this changes over time when our clients become comfortable with the caregivers. And I experienced that for myself. After a week of having someone in my home, I was very sorry to see her go. I missed her because we became friendly in that week. But in the beginning, especially, we have to recognize the difference between hospital work and home care work. So, for instance, in a hospital, when a patient enters, they follow all the policies and the procedures of that hospital. And they understand that they're giving up their independence while they're in that facility. And it's the exact opposite in home care. In home care, we are entering someone else's personal space. People get to live as they choose without judgment. And that is what we work towards at all times while keeping a patient safe, comfortable, give them the assistance with daily living and medication help and food services as they need, without imparting our cultural differences or our judgments on them, but listening to them very carefully to learn what they require and then giving that to them. The team gives support to the family by listening. Again, as I just said, we listen to their needs. Adult children with parents with needs are very, very busy people. Most of the time they're raising families, they're involved in social activities, which they have to give up a lot of times to help their elderly parents. So we try to give them back their independence by earning their trust so that they can go live their lives to a point and we can take care of the elderly. It is very well known and easily looked up, especially in today's day and age, that people who age in place do better, maintaining as much independence as they can possibly do. They remain happier, but safety is a huge issue. And while we need to make sure that they're safe, That is the gap. That is the gap. The gap is maintaining safety in the home so that that person can live there longer. Recognizing changes in their either behavior through dementia or their physical needs, their medications. And once that happens, the RN who visits either every 60 days or whenever there's a change in condition will make sure that these clients have what they need immediately. Our home health aides are trained that when there is any change in their physical condition or their behavior, to notify their supervising RN immediately so that we can get on top of it, work with the family to correct anything that needs correcting so that they can maintain their safety longer in the home. We are here for you. We are here for you in any way that you need.